I would like now to turn the floor over to my good friend, business partner, and Kenyan, Scott Bowman, to lead the next segment. It's an inspiring segment, and it's one which he knows intimately. His family started about 15 years ago a health clinic in South Sudan in a county that today is served by the single clinic, a county of 1.1 million inhabitants. And this is the only health clinic in that county that has the sort of capabilities that the clinic has. So I'll let Scott set up the segment and walk us through this next journey. With that, Scott Bowman.
Okay.
As I make a few opening remarks, I'd like to ask Donato Tramuto and Deng Jongkuch to please join me on the stage. Yesterday from this stage, we heard several provocative statements. Cian Hansen said that CEOs need to think beyond profits to prosperity. Sam Petrotta said that the world needs to be redesigned. Wow. And that inclusion needs to be a design principle of this new world. And today, President Fox gave us a window into what the new kind of leader needs to look like. A leader with compassion, a leader that recognizes that innovation can be a bridge to a new world. This kind of leadership is hard to find, but I've found it in my client, my partner, and my friend, Donato Tramuto. You know, transforming a society, creating new worlds is hard. But it's been said that a journey of 1,000 miles begins with a single step. In the same way, creating a healthier and more prosperous world likewise begins with small steps, and it can be done one community at a time. Ladies and gentlemen, please join me in welcoming Donato Tramuto.
I don't want to leave this world with people thinking that my legacy was starting a business. I want them to know my legacy had always been to help people. Healthy Villages is about collaborating with organizations anywhere in the world to provide them with information and clinical content that will allow them to treat effectively patients and save lives.
For me, what Healthy Villages is, essentially it's a medical library in a portable package. You can take this to places that don't have access to a full medical library. It can be transformative, and I've seen that with my own eyes.
It means access to the resources the staff deserve. This facility is often overlooked because we're out in a rural setting in Kenya, and these staff come in with no resources to fall back on. Healthy Villages is access to more information to help better the care for the patient and to be a better provider.
iPad made resources at the tip of our fingers. We don't have an open library that we could go to. So the iPad become our library. We can open it up anytime and find the information that we need here at Hench.
Sometimes I don't have time to flip the books. I get the device, I touch it, I'm able to get what I'm looking for. At the same time, I'm a trainer. I'm able to teach my students using it. So it has really been effective.
Like Teresa here, we brought her from South Sudan all the way to Kenya, and we're going to teach her for 18 months. But now she's going to go back and she's going to be all by herself. So she's going to have these mothers come that are dying, or small children that need surgery, and she may have questions. She may have to be reminded of some of the things that she's been taught, and having access to any device that will save the lives of the women of South Sudan and the children is well worth a small amount of money.
Et avec technologie que Healthy Villages fait me joindre à travers iPad que me gagne même, moi capable joindre plus d'informations pour continuer. Donc ça me pense me considérer très bien et me pense c'est un grand travail que Healthy Villages a fait.
One of the nurses overnight was dealing with a pregnant mother. When we took her blood pressure, it was through the roof. It was actually unreadable. We were worried about preeclampsia. We were trying to think through the dosage of magnesium sulfate, and we couldn't find a drug index anywhere in the hospital, and we were able to look up the correct dosage.
And that's the success of this device. So I think it has tremendous potential to save lives and create change across the globe.
These are individuals who understand the power of empowerment. You have smarts, you have hearts, you have people who are happy, And so while I recognize I will never change the world in my lifetime, what I can do is move forward the needle a little bit. But to go out and see Lillian and to see her twins, we saved 2 lives. We made a family happy. And those 2 lives will touch many other people. There's nothing wrong with that. Powerful speech. Thank you. Good morning. I now can say I have the honor of having delivered a keynote speech after former Secretary Hillary Clinton and today after President Fox. What an amazing, amazing speech. In preparing for this presentation today, I was reminded of a story, a true story, of a young boy who had lost his hearing at the age of 8 due to a middle ear infection. For nearly 10 years, he was bullied, made fun of, and ridiculed by his peers, his family, and his friends. His hearing loss was so severe that he failed the 5th grade as a result of poor academic performance. For nearly 10 years, he had one experimental surgery after another, a total of 5. In 1972, he had his last experimental surgery, which restored about 55% of his hearing in his left ear and about 60% in his right ear. However, weeks following the surgery, after the bandages had been removed, he was horrified at the way he enunciated his R's and his W's. He was shy in terms of engaging in any conversations with friends. But persistency and tenacity paid off by his attending the local college every single day, where his sister-in-law was a speech pathologist, recording his speech until he felt comfortable that his fluency had been improved. Years later, when it came time to apply for colleges, he was rejected by every single college who deemed him as disabled. But he convinced one college that that label was inappropriate. And so he entered the freshman class of 1975 at a time when his high school students had voted him as the most likely not to succeed. In 1979, he graduated 2nd highest in his college class. Ladies and gentlemen, that young boy was me. I don't know whether it was the long duration of that pain and suffering or the tragic loss of my brother in a car accident 5 years after I had lost my hearing that gave me that tenacity and resilience. But what I have come to recognize, and in a book that I will publish later this year, that moment was my life's caterpillar moment. Yes, just like a bulldozer, you sometimes have to be knocked down to your core, facing the essence of who you are, falling down to your knees to either surrender or survive. I don't vividly recall when I decided that I would survive, but I do recall that during those years when I was bullied and denied the right to be heard, I entered into the quietude of an intellectual curiosity that was fueled by the writings of Senator Robert F. Kennedy and Dr. Martin Luther King. You see, I admired those 2 men for their ability to transform their lives amidst great challenges and tragedy, emerging as 2 of our world's greatest leaders. You see, the value of life's caterpillar moments has 2 venues. Just like the iconic corporation Caterpillar that designs heavy-duty machines, we sometimes have to be knocked down just like a physical building. But we emerge as that other caterpillar into a butterfly that unleashes our entire potential. 2 years before the great Irish playwright George Bernard Shaw died, he was asked by a writer to name a famous person to whom he missed most, a poet, a writer, a philosopher. He sat back for a moment, reflected, and responded, "The person I miss most is the person I could have become." My story today is of two venues. It is the connection of my personal why and my professional why. And what I hope to share with you here today, the integration of those two, the ability to discover your passion and your why, will unleash your full potential. My professional why emerged about 6 months after the restoration of my hearing. You see, that year, my sister-in-law, who I had alluded to earlier, was my speech coach, was also expecting her second child that year. On July 21st, 1972, what should have been a very happy moment for our family turned into a tragedy. Rosemary died giving birth to her second child as a result of a medication error. What I have now learned is that more than 200,000 people die each year because of a medication error that is equivalent to the unsafe landing of 12 jumbo jets each week. Wow. And so for the last 37 years, I have devoted my career to healthcare. In 1997, the first company that I co-founded was a company by the name of Protocare. It was a data aggregation company because I really felt that the physician that evening did not intend to make the wrong mistake. But unfortunately, that attending physician, did not have the information available. And so we launched Protocare, and it emerged into one of the most novel organizations in terms of detecting safety signals with new drugs. But in 2003 and 2004, I realized that what was missing was not just the data, but the technology to deliver the information. What I learned is it wasn't about innovation, it was about integration. Case in point, there are more than 150,000 healthcare apps out there today. It's estimated less than 15% are used. In fact, some researchers now say that no more than 5 are needed. And so the question I ask myself, if in fact we need a platform to deliver the information, how could we address that challenge in a very expedient manner? And so from 2004 to 2008, we spent our time not researching and developing, but we spent the time searching and developing. And so in 2008, we acquired Physicians Interactive, which at that time was a division of Allscripts. And from 2008 to 2013, we acquired 5 additional companies to build one of the largest organizations of physicians. Today, Physicians Interactive, which is known as Aptus Health, has 3.5 million physicians across the world trafficking on that system. They have developed a novel medical app that provides content to physicians at the point of care. So what happened to my sister-in-law can hopefully be prevented in the future for any woman who is delivering a baby. My personal why emerged on September 11th, 2001. By far a day that changed the world, that changed this nation, and changed my life forever. You see, I was scheduled to be on that flight, the second flight that left Boston to LA. On Monday, September 10th, call it fate, I woke up with a toothache. And because my dentist was in Boston, not far from the airport, the Boston Logan Airport, I decided that I would leave that evening. But my 2 friends and their 3-year-old son, who were visiting me at my summer home in Ogunquit, Maine, decided that they would keep their flight on September 11th. And the three of them lost their lives when United Flight 175 hit the North Tower at the World Trade Center. I will not deny here for 1 second that that life's caterpillar moment almost destroyed me. I couldn't understand how anyone could take the life of a 3-year-old boy. Why was my life spared and my friends were not? But rather than wallow in grief, rather than have anger in my heart, it was a time for me to discover my personal why. And so that fall, we launched the Tramuto Foundation, which today we have helped hundreds of young children with disability pursue their college education. We have helped scores of organizations across the world deliver on their promise to make the world more just and fair. This October, we will celebrate 15 years at a gala celebration honoring thousands and thousands of individuals who have benefited from the work of that foundation. The beauty about life's caterpillar moment is that each time you have a challenge, you're able to extract those golden nuggets that helped you recover from that specific challenge, applying it to the next challenge. And so we did not stop with the Tramuto Foundation. In 2010, as I was heading to Europe, I was on a plane reading an article, the content of which is still etched in my memory today, that in our lifetime, 1 billion people will go to their graves prematurely because they never had access to a healthcare worker. 6 million are children who die each year because they never had access to clean water or to medication or to a healthcare worker. Some people have said to me, Donato, that's not our problem. I disagree. Article 25 of the Universal Declaration of Human Rights states that healthcare is a basic right for every single person. And when one person has not had that right, we have violated the Declaration. And so, rather than innovate again, collaborative IQ entered into my mind, simply meaning, why can't we collaborate? Why couldn't we take what we had in Physicians Interactive, which was the medical app, and move it over to Healthy Villages, which is the organization that we formed in 2011. Healthy Villages means heal the villages. And so in 2011, we launched a new program, a new foundation. And the light bulb went off. We can't train enough physicians to address that 1 billion problem. Case in point, in India, a population of 1.2 billion people, 45% don't have toilets. 65% have mobile phones. There are 700,000 physicians in India, the same amount of physicians that we have in the United States for a population that's 1/4 the size. In Ethiopia, a population of 100 million people, there are less than 2,500 physicians. How could we possibly call ourselves the human race? And so let me share with you today the results of Healthy Villages. In 2012, in a small community in East Africa, Luwala, which is pictured up here, infant mortality was 100 deaths per 1,000 live births. Safe delivery of a baby in a community health center by a mom was less than 25%. What we did as Healthy Villages, we did not go into the community and push our vision. We went in and collaborated. We identified the clinic who identified the local villagers as being able and competent to learn how to turn the iPad on. Because it's the local villagers who know who is expecting a baby in the community. What I learned is just because you are poor does not mean you don't have the intellectual capacity to learn. And so we trained 85 local villagers to use our medical app. Today, infant mortality is less than 30 deaths per 1,000 births. 70 more babies are alive today because of healthy villages. 98% of the pregnant mothers now deliver their babies in a community health center. But what we learned was the reason why they were not getting to the community health center is because they were being wheelbarrowed in to the center and they died on the way. And so you see now we purchased a Healthy Villages van. What we also learned is that they didn't have internet connection. And so we picked the phone up and we called Vodafone and said, let's collaborate. Let's work together. And thanks to Vodafone, they now have a cell tower and they're able now to Skype here to the United States when they are faced with a difficult case. In Haiti, 2 years ago, we went back to inspect a Healthy Villages program. And as I was walking down a hospital corridor, a pediatric ward, and because I wear hearing aids, I can, in many respects, hear sounds that perhaps others cannot. I heard this roaring scream. And I asked the chief nursing officer who had been with me, what is that? And she said, I suspect they're resetting the leg of a young boy without pain medication. Without pain medication. The next day, we gathered all the nurses together. Fortunately, we had the tablets and the iPads with us, and we provided every single nurse with an iPad and a tablet, and we downloaded it with pain medication protocols, and we reached out to the pharma companies to make sure they stockpiled the pharmacy so that no 5-year-old boy will ever have to experience what that 5-year-old boy experienced. Afterwards, the nurse looked at me and said, we are not here to prevent death. We are here to extend life. And that what it means to be an integrator is to move the needle forward, to combine your personal and professional why in a manner that helps to advance quickly and with speed the injustice that exists still in the world today. Horace Mann, the great educator, once said, be ashamed to die until you have won some victory for humanity. If I can go from being voted the most likely not to succeed to being on this stage today presenting my talk after the amazing keynote that President Fox delivered today, I know that with our ability to collaborate, that we can score that victory in our lifetime to ensure that no one on this planet is denied access to health care. Thank you very, very much.
Great job. Wow. Donato, thank you.
Thank you.
Thank you for your inspiration. Thank you for your passion. Thank you for your words. You talked about a caterpillar moment, life's bulldozer moment, when life bulldozes you down and emerging a new person, a person with purpose. And it occurs to me that here on the stage with us, Deng Jongkuch from South Sudan. Deng, you also experienced a caterpillar moment in your life that has impacted you. Can you tell us a little bit about that?
Yeah, I believe everybody here has a caterpillar movement in his or her own life, but are you willing to share? That's the question. And thank you for sharing your caterpillar movement. I was born in South Sudan. War has been going on for a very, very long time, until 1987, when the rebels and the government were fighting. I was in the village, My mom and dad keep cattle, they farm, and then the war becomes so worse that the government is attacking the villages. So one day, our village get attacked by the government forces. They come with guns, and I was innocent. I was sleeping at night, and over the sudden, it's sound of bombs, and you see huts in flames. I ran out, and my family ran different directions at that night. At that moment, I never found them until 18 years later. I walked from a place called Bor to Ethiopia with a group of about 35,000 children who didn't have parents, but there were other people who have families. We walked about 4 weeks. We reached a place called Panyundu, a refugee camp established by United Nations. There was nothing. There was no health care. There was no food, because the United Nations was debating here in New York whether actually we were refugees or soldiers. I was about 6 or 7 years old at that time. And then in 1991, the government of Ethiopia collapsed because of they have their own civil war. So the rebels of Ethiopia were friends to Sudan government. When they took over the government, they invited the Sudan government and attacked our camp again in Ethiopia. I was forced to come to South Sudan, a place called Pachala. We stayed there for about 4 months. The United Nations left. We stayed by ourselves. We survived on leaf, vegetable. A lot of people died because of malnutrition and malaria and diarrhea because of dirty water. After 4 months, the Sudan government learned that we were in a place called Pachala. They started aerial bombardment of the camp every single day and night. There were thousands of refugees. And then the Red Cross came in, they dropped the food. So when they when you hear a sound of a plane, you don't know whether it's a bomb from Sudan government or whether it's food from International Red Cross. Sometimes we go and collect food, sometimes we go and bury our friends. And then the ground troop came in, and then they attacked the camp again within South Sudan. And we were forced to move to northern Kenya in a place called Kakuma refugee camp. From 1991 to 1992, I was on my foot, walking, sometimes leaving my friend behind because they just say they cannot do it. Their foot swelled and malnourished, and I remember the moment I left my cousin under a tree. He gave up and said, Deng, good luck. I cannot go anymore. And I still remember that scene. So I came to northern Kenya in 1992. We spent 9 years in a refugee camp. When you are a refugee, you don't have choice of what to eat and what not to eat. The United Nations bring corn, which is maize, beans, and sometimes cooking oil. For 9 years, that was our diet. And then I started going to school under a tree. We learned on the sand, there was no book. To make it short, in 2001, the US government plus other world leaders said, these children has been in refugee camp for a long time. Why don't we give them a second opportunity? I was accepted to come to the US, and 7 interviews to come to the US. So when you hear people come say that immigrants, they don't do screening, I went through 7 interviews. 7 interviews. So 4 of us qualified to 4,000 of us qualified to come to the United States out of 16,000. Remember, there were 35,000 when we were in Ethiopia. When we come to northern Kenya, there were 16,000 that arrived. Half of the children lost their life, and 4 came to the US. When I came to the US, it was completely different. I have to learn how to use vacuum. I have to learn how to use stove. I was amazed that the hot water and cold water will come from the same place. So, thank you.
So, Deng, you here in the United States didn't get cozy with our nice existence here. You built upon that caterpillar moment and decided to do something about it. And today, as an aside, South Sudan is still in a mode of crisis. It is the world's newest country, but life expectancy is only 55 years. The child mortality rate that you talked about, Donato, is the same in South Sudan as it was in Luala. 1 in 10 children died before the age of 5, and today it's listed by Foreign Policy magazine as the #1 most fragile state in the world. Incidentally, I believe Syria is number 6, to put it in perspective. And they're not even on the prosperity index yet. So what did you do? How did you get to that point?
In 2005, I decided to go back to South Sudan to go and find my mom and my family, my dad. Luckily enough, they were alive during the war, and I was reunited with them after 18 years of being away. So as I walk around in the village, I saw children learning under a tree, like I used to go to under the tree a long time ago. I saw girls grounding the grain like this, for the whole day, and like this. And those who are going under the tree, most of them were boys. So I came back to the US. My heart was so filled. What can I do? I go to school full time, and I work full time. I don't have a car. My English was not good. What can I do to help the people in my village? So I struggled with that for some time until I get courage and I say, okay, at least I can tell their histories to the people here. That's what I can do. But I cannot do that much. So I get a courage. I did a presentation at the school, and then another professor invited me. But one picture is stuck in my brain. Girls pounding the grain, and they're not going to school. So I said, maybe I can raise money for a grinding mill so that it grind the grain and girl can go to school, even though it is under the tree. So that movement, as I raised money, I went back, was grinding machine, and then I came back again. Then the school, the students say, can we help you do something? I say, if you want to do something, we can build a school in my village. And then I raised money to build a school in my village. But all in all, what motivated me, I just came back 2 weeks ago. It's a fragile state, but I still can go. I survive. There's a reason why I survive. And the reason is, and I hope it is, that I have to be the witness of my friend that lost their life. And I have to do their services that they're supposed to do to the community for them on their behalf. So South Sudan is so fragile, but I also believe that it is me and other people who can make that country a very good country. So my desire is always to go back and help. Yeah.
So, Deng, you got a master's in public health administration from the US, and you didn't rest on your laurels. You went back and became the first hospital administrator for my family's hospital that my father started, called Memorial Christian Hospital, which today has treated over 100,000 people since it opened short of a decade ago. Thousands of surgeries, is giving a path to a new life for thousands of people. Donato, I think you mentioned, or perhaps it was Rob, the only X-ray system and the only ultrasound system in the entire state of Bor, which serves 1.2 million people. We're providing clean water for a community, and today have a satellite communication system and Wi-Fi, which is now enabling the same kind of collaboration today. And I'm pleased to announce that this year, Donato and Clario, together with Partners in Compassionate Care, Deng's current organization, have partnered to deliver the Healthy Villages platform for pilots of this platform to bring medical content and information to this needy place. I want to thank you for your time. Boy, we could talk all day about the experiences that you both have had. But it's exciting and motivating to see the connections between what you've both said today. Donato, you mentioned we're not here to delay life, or to delay death, but to extend life. Doing well and doing good are not mutually exclusive. That there's this idea of a shared value, and that as CEOs and leaders in our respective domains, we need to think about stakeholders, not just shareholders. We need to think about empowerment, not just aid. And we need to consider what remains yet to be accomplished. The irony is not lost on me that we're following President Fox, who delivered such a powerful and moving address. And with all the negative focus in the news this day and age about immigrants and refugees, I want to contrast the fear-mongering that we hear about in the news with the motivating and empowering perspectives that we've seen today from Deng, who happens to be both an immigrant and a refugee. Currently, there are more than 3 times the number of South Sudanese refugees displaced in South Sudan than have poured into Europe. 3 times. South Sudan has more war-related deaths that they've experienced in the past couple of decades than we have had in our entire history as a country. We've heard today that a radically different story, one of empowering people like Deng to bring hope and healing back to his people, to empower a refugee to bring hope and healing back to his people. And I want to leave you with this question. What would happen if we as leaders embraced a broader mission like Donato has, to build upon our life's caterpillar moments, and we know that we've all had them, to find that passion, that purpose? And what would happen if we empowered leaders, immigrants and refugees like Deng, to return back to their homeland to bring hope and healing? In the words of Robert F. Kennedy, whom I know you admire so deeply, Donato, perhaps these together would provide ripples of hope that together could change the course of human history. Please join me in thanking Donato Tramuto and Deng Jongkuch.
Wonderful, wonderful story.